Minister, Maria Caulfield.
Thank you, Madam Deputy Speaker. It's a pleasure to close this debate after a wide range of speeches. Firstly, though, to acknowledge, I put my hands up that there are challenges and difficulties both in primary care and in dental services. We heard that too from members from Scotland, Northern Ireland and Wales, showing that this is a problem across all devolved areas of healthcare facing exactly the same challenges. But I want to start by thanking all of those in primary care and dentistry for going above and beyond, not just during COVID, but as we are coming out of a pandemic as well. Whether that was dentists doing urgent treatments under difficult infection control measures, or whether that was GPs who took part in delivering millions of vaccines while continuing to see patients. We are now not just seeing the routine number of patients that we would usually see, but for 2 years' worth of patients who stayed at home and protected the NHS as we asked them to do. And despite the protests opposite, we are making progress, and the sheer numbers of patients that we're seeing are hitting record numbers than ever before. We are seeing 1.3 million patients per working day in primary care. That's a 44% increase since last year. 63% of those are face-to-face. That, as the Honourable Member for Wantage says, that's 2 million more face-to-face appointments than this time last year. There are record numbers of GPs, despite what members opposite say. Nearly 36,000 full-time equivalents, which is 1,400 more than March 2019. And we're going further. We have 4,000 more trainees taking up GP training this year, providing more GPs for the future. We've delivered 30 million more extra appointments as part of our manifesto commitment of 50 million more GP appointments. And to show the scale of the record numbers of patients coming through the system, we are seeing 11,000 cancer referrals a day, which is a record high of patients coming through. So how are we supporting GPs? We have the Winter Access Fund with £250 million, which helped deliver a cloud-based telephony system which some practices took up, which is transforming how patients can get through to their practices. And if there are practices that didn't take up that offer, then NHS England is rolling that system out across the country, and I would urge practices to look into that because it delivers better capacity so patients can get through to make their appointments. It brought extra hours to pay for staff to do more shifts and see more patients. It paid for more physical space in practices as well. We have delivered 13,000 of our 26,000 manifesto pledge of additional roles. That's paramedics, practice nurses, primary care pharmacists, physios and OTs working in primary care. We are tackling the bureaucracy that GPs are facing and laid the statutory instrument tackling the fit notes to allow those professionals other than GPs to return people to work. We've developed the pharmacy consultation system, where dialling 111 or the GP receptionist can refer people directly to a pharmacy for first-line care. We're developing and renewed the GP contract, opening up access at weekends and in evenings. We're expanding community pharmacy with our work on Pharmacy First, whether that's dealing with minor ailments, blood pressure checks, discharge medicine services. We're also tackling, as my honourable friend from North East Bedfordshire said, the infrastructure problem in the Levelling Up and Regeneration Bill, where health and local government are working hand in hand to tackle the issues that he's raised. We're also delivering, no, I will not give way. We are also delivering the zero tolerance to abuse through the Police Crime and Sentencing Act, where Labour talked the talk, but where it was this side of the House that voted to double the maximum sentence for those who abuse our emergency care workers, and where Labour actually voted against it at third reading. That tells you all you need to know. Now, Madam Deputy Speaker, with the time I have left, I will not give way. Members did not...
Order! If the Minister isn't giving way, she isn't giving way. Minister?
Thank you. I'm not Fritz, Madam Deputy Speaker, but I'm conscious there is another debate after this. Now, I didn't want to play politics, but if members opposite want to play politics, I will give them politics. This is the party opposite us that are against everything and for nothing. Not one suggestion, whether it was for the Lib Dems or whether it was from the Labour Party. Completely full of complaints, but for not one single solution. We know that the Shadow Secretary of State has been busy deleting his past misdemeanours over the weekend, but he can't delete Labour's past misdemeanours with the NHS. And as Davina McCall would say, let's have a look at their best bits. Where if we look at the PFI contracts that they mysteriously introduced, £1.4 billion is still being spent annually in rent to private investors because of the deals made under Labour. Fullfact.org confirmed £57 billion will be spent in total on those PFI deals.
Shocking.
If we now move to the 2004 GP contract negotiations, where evening and weekend cover was taken away, handed to primary care trusts and given to private companies. Or if we could look at the 2007 changes in the law, which members opposite voted for, to allow bigger businesses to buy up GP practices, resulting in the evidence we saw in the Panorama programme last week. Or the top hit is the 2006 Labour dental contract, where members opposite, he may say, here we go, his members opposite this afternoon actually acknowledged it was the Labour contract causing the problems. We are getting on with dealing with that. My honourable friend from Waverley asked what progress is being made. We put the negotiations to the BDA on the 24th of March. We have made the final offer on the 20th. They don't want to listen, Madam Deputy Speaker. They don't care. We put the final offer to the BDA on the 20th of May, and we're waiting to hear back. But it's not just the dental contract we're reforming, which firstly does disincentive dentists to take on NHS work. And can I just correct the honourable member for Portsmouth South for his hosting of a dental summit? He didn't host that dental summit. It was the right honourable member for Portsmouth North, because she invited me. They've come up with a solution, and I'm meeting with her team so we can work on it and take it forward. In addition to the contract, Madam Deputy Speaker, we are reforming how we take on overseas dentists. We consulted with the GDC, who ran a consultation up to recently, and will be laying legislation to give the GDC powers to allow overseas dentists to come here more easily.
I can hear what you're saying there. That's just not right. It's simply rude. We're supposed to be listening to the Minister. Stop it. You're not saying anything while you're sitting down. Nothing. Minister.
Thank you, Madam Deputy Speaker. They don't actually want to hear some of the work that the government's doing. They're just too busy criticising. My honourable friend for North Wycombe and Sleaford also mentioned the work we're doing on centres for dental development. We're already working in places like Cornwall to start training more dentists in those areas. In Norfolk and Norwich, we've also met with the university there, led by local MPs who brought people together to set up centres, and also in Lincolnshire as well. We're empowering the dental workforce by changing and upskilling dental technicians, dental nurses, dental assistants to be able to take on more work. And we're also tackling the issue of clawback. Now, you would think, Madam Deputy Speaker, this is just an issue in England. But if we look at Labour-run Wales, where the Community Health Council have acknowledged that in Wales they're facing a crisis of access to GPs, where patients are waiting more than an hour to get through on the phone and there are no appointments left. Dentists in Wales, last month, practices in Wales fell by 1,500 in 2019, down to 1,389 last year. In the last year alone in Wales, there was a drop of 71% of courses of dental treatment in Wales. Now, why is that under a Labour government there? Now, opposition parties are here today, and they are not. I've given the answer. They were too busy talking, Madam Deputy Speaker. They didn't want to hear the answers. Opposition parties opposite need to be honest with the public. Whether it's in Scotland, Wales or Northern Ireland, we are all facing the same challenges. There's Labour government in Wales, there's the SNP government in Scotland. They can continue to play with politics, but we are getting on with the business of reforming those changes. The members opposite have no solutions, no answers and no ideas. It's this government who's delivering the changes, and we are being honest with the British public. There are challenges we will face, but we are making the changes to improve access to both dental and primary care services.